floor is yours.
Thank you very much, Abigail, and welcome everybody to the first webinar of the thematic network Peitho. My name is Ludovico, and together with my colleague Anouk, we manage the thematic network on One Health Peitho. If I could have the my slides, yes, wonderful. Thank you very much. Right. Okay. So let's start. What is the thematic network? What is Peitho? Well, most of you probably got the information of this webinar through the thematic network itself, so might be already familiar with it. For the others, Peitho is the thematic network on One Health, which is set in the frame of the EU health policy platform. The health policy platform, of course, is a service of the European Commission DG Santé, but Peitho itself is managed by the European One Health Association. And in a minute, I'll give you just another piece of information about this association. Peitho started late in 2025, January 2026, more or less, and we will work until September 2026. The aim is to strengthen the transdisciplinary, interdisciplinary, and cross-sectoral approach to One Health challenges in Europe. Our ultimate goal is to support operationalization and possibly institutionalization of sustainable One Health solution. Peitho works with the virtual space provided by the health policy platform. You can exchange in this virtual space. We can work on some documents. So please, I would encourage all of you to join our platform. You can find the link here on the left side of the presentation. There's also the QR code. The final output of Peitho will be a joint statement and one additional, another couple of information on this in a second. Okay, so Peitho is managed by the European One Health Association. Just very, very briefly, the European One Health Association is a network of public health, food safety, and veterinary health institutions in Europe. We're talking about public institutions. We focus on the zoonotic infectious diseases, on the antimicrobial resistance, and our final aim is really to reinforce the prevention, detection, and control of zoonosis and AMR in Europe. At the moment, we are expanding our members to bring on board also institutions that deal with the health of the environment. So we are managing the thematic network Peitho. In this contact list, I mean, you'll have the presentation, so don't worry about this. You find our contacts in bold, we who manage the platform, and then our management team of the association. Let's go back to Peitho. First, a small trivia. Peitho stands for Platform for European Interdisciplinary, Transdisciplinary, Holistic One Health. And as it happens, is also the name of the Greek deity of elegant speech. So here you can find the representation on the vase of the classic period. Her symbol is the dove, therefore we have chosen the dove as our symbol as well. As said, the final output of Peitho of this thematic network will be the joint statement. This is a collaborative position document, meaning that we can all co-write this, and on the platform itself, you can find the link to the draft document. You can also start to bring your input. This joint statement will include a roadmap focused on the operationalization of One Health solutions in Europe in relation to the EU health policy agenda. What does it mean practically? It means that this joint statement will include advices in order to follow the recommendation given by an important document, which is the Scientific Advisory Mechanism, SAM document, One Health Governance in the EU. The SAM document has a number of recommendations. We want to collect indication on how to best follow them. So really something practical. The joint statement will also include a call to action to encourage the stakeholder to bring this action up and therefore improve the operationalization of One Health approach in Europe. Now, what is rather important about this joint statement is really the target. The target are the stakeholders relevant to One Health in Europe. Who are the stakeholders? The stakeholders, well, that's us. Research performing organization, reference laboratories, institute with official tasks, NGOs, but also Association of the Industry, Professional Association, EU agency. So these are the stakeholders, really the people that work with One Health solution. So that the joint statement will be a document written by us for us, but it could also be used by national and EU decision and policymakers. So these are kind of our secondary target. What does it mean? It means that a policymaker could take a look at this joint statement, understand what is going on in Europe, what are our plans regarding One Health in Europe, and therefore a policymaker could then set up good actions to support us. So I would say that the joint statement is really a bottom-up initiative, bottom-up approach that helps us, but kind of also supports top-down initiatives. All right. Very, very briefly, very quickly, the joint statement is structured in 3 pillars. Each of these pillars addresses some recommendation of the SAM document, One Health Governance in the EU. We cannot address all of them because we are very limited in time. And we also organize webinars. Webinars are an important part of Peitho. The webinars really, each webinar addresses one pillar of the joint statement. We want to focus on the case studies and examples. We want to exchange. We want to see what works, what does not work, what is there to improve. Really among ourselves. The first webinar, it's today. It's on One Health Networks. We'll have another one on research and innovation and application of the One Health outcomes in 1 month, and then a third one on operationalization and governance in 1.5 months in June. All right. I think I have talked enough. Jed, let me introduce the webinar of today, Consolidating Europe's One Health Network, Integration of Underrepresented Sector. Of course, there are a number of sectors which are not fully on board of One Health activities in Europe. There's the social sides, political, economical sides. We cannot really tackle all of them. We have decided to focus on 2 of those underrepresented sectors. Well, the quintessential and the sector which is still not enough represented is the environmental sector, of course. We're still there. And then the second topic that we want to tackle is the equity and inclusion in One Health initiative. Equity and inclusion is something that one could tackle only if we bring on board the social sciences. So this is what our agenda will look like today. We'll have a first talk by Edward Pop on the environmental dimension of AMR, a brief discussion, another talk on the initiative Women for One Health by Kim Weistzar, another brief discussion, the remarks by the colleagues of the Commission given by Sigrid Weiland, and then some final remarks from my side. You can feel free to use the chat. You can feel free to raise your hand after each presentation. We'll give you the floor. If you feel like you wanted to say something but you didn't have the chance, or something came into your mind later, don't worry. We have set up a survey. You can take the survey. You can add your reflection there. You can also add your reflection on the platform itself. We have 2 experts tackling these 2 issue, environment and equity and inclusion. Maybe we can go on, and I would like to give the floor to Edward Top, our first speaker. Just one word of introduction about Edward. Edward is an environmental microbiologist and a chemist. He conducts research on animal and crop production practices that are protective of the environment and of human health. A particular focus is the mitigation of the development and transmission of antimicrobial resistance. He's research director in the agroecology unit at INRE in Dijon, and he has vast experience on AMR, on environmental research, and also, I would say, on science to policy translation. All right, so Edward, the floor is now yours.
Thank you. Thank you very much, Ludovico. Uh, Great pleasure being with you this morning. I'm based in beautiful Dijon in Burgundy, and I'm very happy to be here. So I'm going to take a few minutes to speak to you about the environmental dimension of AMR, as Ludovico said, an aspect of AMR which is probably underrepresented within the One Health framework. If you have a particular interest on this topic, I would recommend these documents, a report issued by the UN in 2023 that I'll be referencing through this talk. On the top right, a paper from the European Food Safety Agency concerning the environment and food. And at the bottom, a paper that viewpoint that we recently published, which is essentially environmental AMR for the non-microbiologist. So some preliminary considerations. The words antimicrobial and antibiotics are often used sort of together. Antibiotics really mean antibacterial agents. Antimicrobials would include other microorganisms that are targeted with compounds that are toxic. I'll be speaking today largely about antibiotics. Resistance to these agents can be intrinsic or acquired. From the human health perspective, it's the acquired resistance that's problematic. So you've got a medicine that can treat a bacterial infection effectively, and the bacterium evolves to be resistant to that chemical, so it's not effective anymore. So really, we're interested in acquired resistance. There are several classes of antibiotics that have different properties, and there are several mechanisms of action and breadth of activity. So antibiotics are not really one thing from the environmental perspective. You need to think about these chemicals class by class or agent by agent. So the challenge that we have is, as illustrated in this figure here, is that you have a series of arrows, the blunt end indicating the year at which that antibiotic or class of antibiotics was first brought to market. And the pointy end of the arrow is the first year where resistance to that antibiotic was detected. So the take-home message is, as these antibiotics have been developed and brought to market, within a few years, microorganisms learn to be resistant to them. And the potential catastrophe that we're looking at is when pathogens of human or animal health learn to be resistant to every class of antibiotics. And therefore, if you have an infection, a physician no longer has an option to treat you. And so the consequences of antibiotic resistance as we're living them now, and potentially as we may have to live with it in the future, is that we're looking at increased healthcare costs with more expensive drugs, hospital visits rather than treatment at home, intravenous versus oral treatment. We're seeing deterioration in statistics for mortality and morbidity due to resistant infections. And this is a disincentive to bring new antibiotics to market. If you're big pharma and you're going to spend 1 to 2 billion euros to bring a new antibiotic to market, and you know that chemicals will become ineffective within a few years, why would you do that? And we're looking at the potential for return to the pre-antibiotic age with the potential development of pan-drug resistance, and that will be a catastrophe that obviously we want to mitigate. So the strategy that we're using either nationally, regionally, or globally to try to reduce the pace at which AMR develops is by reducing selection pressure across that One Health continuum. So in the human setting, in the top of this illustration here, try to reduce the use of antibiotics to the minimum necessary in healthcare settings or in the communities by deploying vaccination, diagnostics, so that you only use an antibiotic when you absolutely have to. The bottom left of this image is agriculture, terrestrial and aquatic agriculture, which is where the majority on a mass basis of antibiotics are used. So here are the strategies to keep farm animals healthy using other means so that you can reduce the use of antibiotics. So again, vaccines, nutritional strategies, husbandry strategies to reduce selection pressure in the food production system. And finally, in the bottom right, the environment, which is what we're going to talk about today, reduce emissions of antibiotics and resistant microorganisms into the environment. When we think about environmental AMR, there's really 3 issues we're aware of. One is the microbial in the planet a billion years is the source of genes that confer antibiotic resistance to human or animal pathogens, and the genetic machinery that will mobilize those genes into aggravating the problem, so increasing the reservoir of AMR genes in the environment. We'll talk about that in some detail. And finally, the environment is extremely important for dispersal and transmission of resistant bacteria and the genes that they carry, particularly waterborne transmission, but also airborne transmission and soil. So overall, the environment plays a key role in the development, transmission, and spread of AMR. So I referenced this report from UNEP, United Nations Environmental Program, and this report is a technical but also a policy relevant report. And what we did, I co-authored this with a number of colleagues, was we looked at 3 economic sectors and their value chains that have a role in environmental AMR. So the production of pharmaceuticals and other chemical manufacturing, agriculture and food production, and healthcare systems. So how can these value chains be modified or improved to reduce environmental consequences with respect to AMR? So pharmaceutical manufacturing and other chemical value chains, this is particularly important in China and India, where most of the pharmaceuticals that are consumed in high-income countries like Europe and North America are produced. And there, what we would seek to do is to enforce discharge targets so that we have less emission of antibiotics into the environment through waste streams from factories, embed waste management and a life cycle approach into SOPs, improve supply chain transparency, and monitor antimicrobial resistance and resistant microorganisms that are in areas that are receiving effluents from factories. And there's been quite a bit of debate here in the science community, in the policy community, and the industrial community. And there is a move afoot to implement guidance and for antibiotic pollution from manufacturing. So I would say that this is a good news story, if you will, that's still evolving, but there has been a lot of movement. In the healthcare setting, as I said here, it's all about reducing antimicrobial use for treatment of people and ensuring disposal and treatment of antimicrobial medicines and hazardous waste from healthcare settings, for example, and leverage hospital stewardship and IPC, infection prevention and control, to limit environmental contamination by AMR pollutants. The third value chain, and the one I'm personally most familiar with, is food production. And here, what we would seek to do is improve the management of biosolids and manures to reduce contamination of crop production systems with antibiotic residues that are excreted by people or pigs or poultry, and reduce contamination of crop production systems with resistant bacteria that have been selected for in people or pigs or poultry, for example. As I said, reduce antimicrobial use in food production animals by improving animal health and providing barriers or treatment of water entering and exiting aquaculture facilities. And I would highlight here that not in Europe, but elsewhere, antibiotics are used in crop production systems directly to treat bacterial infections of plants. And fungicides are used to treat fungal diseases of plants. We don't know yet whether the use of antibiotics is directly promoting AMR in these food production systems, but we know with certainty that the use of certain fungicides has resulted in the development of resistance in fungi such as Aspergillus fumigatus that is now extremely problematic in clinical settings where people who are immunocompromised can have infections with these fungi, and essentially they can be untreatable. So barriers to including the environment in One Health AMR mitigation strategies, I would say in general, there's 2. And I would say that there's an analogy to climate change. It's very much the other One Health problem. So we have vested interests in the pharma and healthcare sectors to use antibiotics on the one hand, and on the other hand, as I've said, we want to minimize their use to the minimum necessary. And there's a barrier with respect to governance, so that decisions on antimicrobial use are disconnected from the consequences. So if you're an agriculture ministry and you're providing guidance or allowing antibiotics to come to market to keep farmers profitable, the potential consequences of that with respect to healthcare are disconnected from those decisions. So in the discussion of this group here, how can governance in the EU be done to try to connect those in a better way? There have been some positive policy developments in the EU. And the example that I would give here is the revised Urban Wastewater Treatment Directive. So here, the objective is to improve wastewater treatment for municipalities to essentially clean up emissions from cities, and moving forward to monitor wastewater for health parameters such as pathogens and AMR, which is what we're talking about today. And so there are moves afoot, initiatives to make decisions on how AMR will be monitored, to try to develop monitoring systems that are better suited for risk management. And so that is another positive development. There are initiatives such as the EU JAMRI project, which is promoting information from surveillance systems and conduct scoping studies in the use of disinfectants and fungicides in the EU. And finally, I would wrap this up by making a promotion for a conference that's going to be held in Australia in August of this year, which will encompass all aspects of environmental AMR. We have about 400 presentations that will be given. And if you have a particular interest in this, I would invite you to join us at this conference. And Ludovico, with that, I will finish. Thank you very much.
Well, thank you very much for the very clear and all-encompassing presentation. If there are any question at this moment, Anouk, anything on the chat or any hand?
Yes, from the chat there's a question. Have you taken in consideration the relationship between AMR and electromagnetic fields? Since there are articles about it.
No, I have not. And in fact, I don't really understand what that might be. Perhaps whoever asked the question could clarify that.
Right. So there's, of course, our survey. There's, of course, the platform where this can be further. We can go into detail regarding these topics as well. I see that, Andrea has Winkler, you have your hand up.
Yeah, this is correct. Well, thank you very much for this important presentation. Just one question: conflict and heavy metals and AMR. Where do we stand?
Right. So this is a question of other kinds of chemicals selecting for AMR. Heavy metals such as copper would be one example. Biocides might be another example. So here the issue would be if an organism is resistant to copper, for example, it will also be resistant to other kinds of antibiotics, because the mechanism of resistance to copper in many instances will be a pump. So the organism will pump copper out of the cell, and that pump can also pump out antibiotics, certain antibiotics out of that cell as well. Another interesting aspect of heavy metals is as a fitness determinant. And there's a study that's been published here in France where a colleague isolated strains of Pseudomonas aeruginosa, which is a bacterium, which is a serious pathogen for immunocompromised people in the hospital. And he was able to isolate it from sinks in hospital rooms. And the piping in those sinks is made of copper, which is toxic. And they sequenced the genome from that organism and found a genetic island that confers resistance to copper so that the organism can survive and flourish in the sinks in the hospital. Independently, another colleague isolated a different species of Pseudomonas from vineyards here in France, where copper has been used extensively for a century, sequenced that genome and found the identical genomic island, which allows the organism to persist in soils that are heavily contaminated by copper. So that would be another illustration of the use of chemistry in agriculture, certain kinds of chemicals in agriculture, resulting in the evolution of an organism that's of human health concern. So again, it's that One Health link between activity in the agricultural sector and a consequence of the human health sector.
Thank you.
I would also have one question. In your presentation, we have seen a number of sources of AMR in the environment. There's the food production, the healthcare setting, the pharma industry, but resources are limited. So from a policy perspective, where do you think it makes more sense to have a mitigation action? In which point?
Right. So this is always a challenge. So on the one hand, you need action right across that One Health continuum. Whatever specific action that you take needs to make economic sense within that particular value chain. In the agricultural sector, if you reduce the use of antibiotics that's going into a barn, you're reducing environmental emissions of that antibiotic and AMR bacteria coming out of that barn. You're also reducing transmission of AMR via the food chain, because the food products that are coming out of that barn will be less contaminated with AMR microorganisms. So that clearly would be one example. Another example, which is maybe less relevant for Europe, but certainly relevant for lower income settings, is improving wastewater treatment and sanitation. And you need to recognize that AMR is a global problem. If we're generating AMR microorganisms in India or China or Africa because they have very poor wash, those microorganisms inevitably will come back and bite us here in Europe. So those would be some examples, and it's an excellent question. I would encourage folks to look at that report if you want to look at this in more detail.
Thank you very much. And of course, increasing sanitation has other positive effects on the public health in total,
right?
Not just AMR. So thank you very much. Anouk, do we have other questions, for example, on the chat?
Yeah, there's a comment on the chat. It's quite long. I don't know if the person who wrote it would like to summarize or ask a question about it. Yes, so please, Edward de Beukelaar. I think you are unmuted now. You can take the floor.
I'm trying to find the question.
So the question is the last comment in the chat, and Edward, you can unmute your microphone now. You are now panelist.
Okay, yeah, well, my audio disappeared. Yeah, just I think it's interesting, this relationship that the bacteria will actually go and mix all over the world. And I think one thing which I always find a little bit missing in One Health discussion is the health aspect. Is how do we make environment healthy? How do we make people healthy? How to make animals healthy? Because health and resilience is something that comes together, because bacteria will always be there. And I found the aspect of fostering health and resilience seems to be quite often absent in the discussions. I think our knowledge of bacteria is very good by now, and what you explained is really important in this in One Health. That what happens somewhere else in the world will affect us. But I think is one way to actually reduce that pressure of bacteria is actually by fostering and improving the health of everybody, which comes together with sanitation and with social aspects of One Health. That's just a little point I wanted to make. Thank you.
Yes, I agree with that completely. We use antibiotics when something has gone wrong and people are vulnerable to infections and there's an infection. So as you say, if we keep people healthy, either with the use of vaccines, proper nutrition, proper water treatment and sanitation, obviously fewer conflicts globally, et cetera, we'll all be better off.
And stewardship.
Stewardship, yes.
All right. Thank you very much for this comment, which also links the One Health to the global health, I would say. Another incentive to look outside of our strict borders. Is there any other comment, any other reflection, question?
I don't see any hands, but maybe I can ask a question myself as well. So in your opinion, what would an effective One Health governance in the EU actually look like? So in order to successfully reduce AMR in Europe, what would you?
Yeah, it's an excellent question. I don't have enough knowledge about the institutions and how they operate within the EU to give a concrete answer. The general answer I would give is what we're looking for, as I said in the presentation, is to better link those sectors that are using antibiotics or emitting antibiotics with those sectors that that will bear the consequence.
Okay.
Thank you.
And my personal experience with this kind of question was within the government of Canada, where I coordinated the federal research program on AMR. And I could see that the different ministries, agriculture, health, environment, were not linked together with respect to decisions that we're taking and the consequences that would flow out of those.
All right. Thank you very much. This also links to the other underrepresented sector in the One Health arena, the economy, for example. How do we set up One Health initiatives that are valuable? This is also another issue that we cannot really tackle here, but important to consider what is really the economic value of the One Health initiative. How can we set up One Health activities that have also an economic value, and how do we calculate that?
Yes, and I find in agriculture, to get back to that, is often the specific objective of reducing AMR. You may not be able to make a good business case from the sector's perspective, but if you can find practices that have the co-benefit of reducing AMR and zoonotic emissions, that's the way to go. And the example that I would give is if you're looking at manure, for example, from a large animal farm, and you can implement anaerobic digestion in that operation to make biogas and recover energy that's valuable. And that process has the co-benefit of reducing microbial contamination of that material before it's used as a valued fertilizer. It's a multiple win-win-win. You're protecting water quality, protecting crop quality, reducing entry of pathogens and AMR bacteria into crop production systems, and putting a bit more money in the farmer's pocket. So if you think about co-benefits of those particular systems, you may find practices and be able to deploy technologies that have the co-benefit of reducing transmission across that One Health continuum.
Thank you very much, and that would be really as cross-sectoral as it gets. And Anouk, unless there is another comment, another reflection.
Yes, there's one last call.
Maybe we have time for just one last comment. Yeah.
So it says, for me, what's often missing in the One Health discussion are other aspects of the environmental perspective. So it's not only AMR that's affecting human health, but also chemical pollution of the environment, noise pollution, overnutrition, etc. And I would be happy to see these aspects being integrated more in the future.
And it's within the context of climate change. Yeah.
Absolutely.
So the major topic of my work here in France has to do with precipitation patterns changing in the context of climate change, and around the Mediterranean basin, for example, the absence of water is threatening food security. And in that context, we want to use more effluent from sewage treatment plants to irrigate crops. And so the question is whether an increase in that practice will increase transmission of AMR or other kinds of bacteria to humans via the food supply.
Another complicated issue, but is on the table. So that is, I think, a positive aspect.
Yeah.
Well, thank you very much. Thank you very much for your presentation, for your reflection. And I think at this point, I would move to our next keynote. And I'm happy to thank you very much. Please feel free to stick around until the end of the of the webinar. I would now move to our next keynote, Kim Weisser. Kim Weisser is a science manager and researcher at the Center of Global Health at the Technical University of Munich. Within the Women for One Health, she's the German community manager, and she focuses on topics such as diversity, equity, inclusion in One Health, and she's also involved with other projects, for example, the well-known Lancet One Health mission. Laura has also vast experience in international project management, and I'm very looking forward to your presentation. Kim, the floor is yours.
Hello, everyone. Thank you very much, Ludovico and Anouk and Abigail for the introduction and chairing and moderating today's webinar. And thank you to the whole team of Peitho for inviting us to this session. I also very much enjoyed the presentation from Professor Top. Yeah, I have a bit of a cold, so please excuse me if my voice cuts out at times, but I've been keeping it well hydrated, so I'm prepared. So yeah, I see the slides are already there. So I'm very pleased to give a presentation about empowering women and advancing equity and inclusion in One Health, and as mentioned, to briefly present the Women for One Health network in this context. Next slide, please. So I'll briefly guide you through what I'll cover today. First, I'll introduce One Health as a systems approach. You've probably heard that before, so I'll keep it brief. And then we'll look at why equity and inclusion really matter in practice. And after that, I highlight some of the current gaps in One Health. And then I'll introduce the Women for One Health network as a practical example. And finally, share some thoughts on what we can do moving forward. So next slide, please. So starting with One Health, as you're probably very aware of, the idea is quite logical for us. Health is interconnected. So One Health recognizes the interconnection between human, animal, and environmental or eco-health. And those domains are closely linked. We can't really look at them separately because health challenges can be very complex and cross-sectoral. For example, zoonotic diseases move between animals and humans. Climate change affects ecosystems and disease patterns, and antimicrobial resistance, for instance, spans across sectors. So One Health is really about bringing different disciplines together to address these complex challenges. And therefore, One Health can be understood as a socio-ecological systems approach. By the way, much of this is also reflected in the work of the Lancet One Health Commission, which was published in July 2025 under the leadership of the two joint chairs, Professor John Amrasi from Ghana and Professor Andrea Winkler from Germany. And yeah, the commission brought together a very interdisciplinary group of many experts to compile evidence and provide a kind of roadmap for implementing One Health globally. And it outlines 10 key recommendations, focusing in particular on strengthening governance, improving cross-sector collaboration, and embedding One Health more firmly in policy and practice. And I think what is especially important is that the report clearly shows that One Health is not just a conceptual framework, but requires real changes in how we collaborate and how we govern systems. So I highly recommend to have a look at it. You can find the commission online under the Lancet One Health Commission, and the recommendations can be found in the appendix. Next slide, please. So on this slide, you can see an image that I actually took from the Lancet One Health Commission, and it beautifully shows One Health as a system. So One Health represents an integrated and interdisciplinary approach to health. It's not a linear process. It's a network of interconnected factors, and changes in one area may affect many others. For example, deforestation can bring wildlife closer to humans, which increases the risk of disease spillover. So the key message here is that we're not dealing with isolated problems, but with interconnected systems. Next slide, please. Now moving to equity and inclusion, it is important to recognize that health risks are not equally distributed. For example, people in rural areas may have less access to healthcare, and women in some contexts may have less access to decision-making. So gender, income, education, geographic location, all these socio-demographic factors directly influence health outcomes. So yeah, if we don't take them into account, our intervention might miss the people who need them the most. So including different perspectives actually can improve the outcomes, because people bring different types of knowledge. For example, also like local communities understand the local realities, and scientists or social scientists understand behavior and barriers, or clinicians, for example, understand the treatment. So if we combine these perspectives, we get solutions that are more practical and might be more effective. And therefore, evidence suggests that inclusive governance improves decision-making and program effectiveness, legitimacy, as well as the sustainability of One Health initiatives. And just to quickly explain, effectiveness is commonly assessed through indicators like health outcomes, like intervention uptake, etc. So does the intervention actually work in practice? And yeah, with legitimacy commonly assessed through indicators as trust among stakeholders, and participation in decision-making, acceptance, etc. So do people trust and also accept the intervention? And sustainability associated, of course, with long-term funding, institutionalization, and lasting impact. So it refers to whether interventions are maintained over time. Next slide, please. So coming to the current challenges, even though One Health is widely accepted as a concept, for example, through OLEP, the One Health high-level expert panel, there's still a gap when it comes to implementation. So many sectors still work in silos, and collaboration is often limited. So social perspectives like gender or community dynamics are also often underrepresented. And yeah, we are quite strong, I would say, at defining concepts, and we're getting better in strategies, but implementation is where things become really difficult, because this is where coordination and governance and real collaboration are needed. Yeah, by the way, just 2 or 3 weeks ago, the One Health Summit took place in Lyon under the G7 presidency, where Mr. President Macron emphasized exactly this point. And also a good example of concrete implementation efforts is the recently established Scientific Advisory Board on One Health of BMZ, the Federal Ministry for Economic Cooperation and Development in Germany. And the constituent meeting of the newly appointed board took place this April, last week actually. Next slide, please. So despite increasing recognition of the One Health approach, there are implementation gaps that remain. We can see limited integration into expertise, unequal access to leadership, and weak institutional support or institutional and structural barriers itself, and also limited investment in prevention and preparedness. And I think important to mention is that the issue is not that there are no experts, and there are many, but they are often not connected or don't have equal access to opportunities. So the issue is not the absence of actors, but the absence of connection and access and institutional support. Next slide, please. Which takes us to the topic of inclusion. So inclusion is often seen as an ethical issue, but it's also very, very practical, based on experiences and several case studies from, for example, the IPCC, the Intergovernmental Panel on Climate Change. Diverse teams tend to make better decisions because they consider more perspectives, and inclusion may also support innovation and helps build trust, which is essential for implementing health interventions at the end. And inclusive leadership promotes sustainability. And this is also something we can confirm from our own work at the Center for Global Health, for example, through the Prati-Quantel consortium, in which our social science unit has been involved. So all in all, inclusion is at the end also a core component of resilient health systems. Next slide, please. So what is the role of social sciences? So biomedical solutions alone are insufficient to address complex health challenges. And this is where social sciences become very, very important. So health challenges are not only biological, they are also shaped by socioeconomic, environmental, commercial, and political determinants, as well as power dynamics. A very simple example, even if a vaccine or a medication is available, people might not take it if there's a lack of trust. Or in general, a health policy that works well in, for example, a European city, for example, a digital appointment system, may not work in regions where with limited internet access. So it needs to be adapted. So technical solutions alone are not enough, and we also need the social understanding. And yeah, policy translation always needs to be contextualized. Next slide, please. So this brief context of diversity, equity, and inclusion brings me to the introduction of the Women for One Health network. Women for One Health is a platform of One Health professionals and enthusiasts that focuses on collaboration, leadership, and advancing equity and inclusion in One Health. And we are funded by GSZ, the German development agency, and the primary aim of the network is to build an inclusive movement, form alliances, create opportunities for women, but also other underserved groups, and therefore increase our visibility. Next slide, please. So our mission is to support women and other underserved groups by fostering One Health knowledge, action, community empowerment, and leadership to drive transformative change for improved health and well-being for all. So we want to promote gender equity and inclusion. We want to strengthen interdisciplinary collaboration, support professional development across sectors, and therefore create opportunities for underserved groups. Next slide, please. Women for One Health was founded in 2022 by our two founding directors, Dr. Heidi Auerswald and Professor Andrea Winkler. And to date, we have over 900 members from over 100 countries worldwide. Next slide, please. As you can see, approximately 20% of our registered members, so registered in our online expert database, which are around 500 in total, are based in Europe, with the UK, Germany, Italy, Switzerland, and Austria as the top 5 represented countries. And as you can see on the right, more than 1/3 of our members are based in Africa. Next slide, please. This could also be due to the fact that we have established 3 secretariat branches, 1 at the Technical University of Munich and 2 with our partners in Rwanda and in Kenya. Here you can see our management structures, I would say. So our 2 co-founding directors, Dr. Heidi Auerswald and Professor Andrea Winkler, who is also a co-director of the German Secretariat, and our directors, Dr. Phaedra Henley from the University of Global Health Equity in Rwanda, and Dr. Lilian Waibofi from the University of Nairobi in Kenya, and Helen Kariuki and I as the two community managers of the network. And Helen is also based at the University of Nairobi in Kenya. Next slide, please. So in practice, we have several activities going on. We want to build an interdisciplinary professional network through our platform. We promote visibility and representation through participation in international conferences like the World One Health Congress 2024, the yearly One Health Summit in Berlin, the ACTME, the European Congress on Tropical Medicine and International Health in Hamburg, and more. We also support mentorship and leadership pathways. So we have our own mentorship program with around 35 to 40 active pairs to date. And the program is led by our partners from the University of Nairobi. And yeah, we want to foster cross-sector and cross-regional exchange, for example, through our regular meetings and on-site gatherings and get-togethers. And we want to advocate for inclusive One Health governance through, for example, involvement in committees like the World One Health Congress and panel representation and diverse events. And also, for example, through our collaboration with the Lancet One Health Commission. Next slide, please. So what are we doing concretely? So there are many activities going on within the network. Like I said, we have regular community meetings where we, for example, give updates on current projects, talk about events, and have like research presentations. Also, our first big output was a letter to the committee of the World One Health Congress in Singapore 2022 to ensure equitable representation of women in the coming congresses. And as a response, we were invited to support the committee of the following World One Health Congress that took place last year in Cape Town. So we worked together and were also invited to a panel and held a poster presentation. And we also did presentation trainings for our members and beyond, of course, before the Congress for early and mid-career researchers. And these trainings were also included in the actual program. And as a result, the last World One Health Congress did much better in terms of gender representation, but also regional representation. And furthermore, we established our secretariat structures and a One Health expert database integrated into the website. And we also have a webinar series called Voices of One Health Implementers. And we advised the FGS initiative in collaboration with the GIZ. Next slide, please. And besides that, we also have small research projects. For example, we are analyzing the gender composition and geography of leadership in One Health networks. We wrote an opinion piece on DEI in One Health, published in One Health Outlook. And we have published a paper based on an e-survey that explores the barriers of underserved groups in participating in international health events. And this was published in Kabi One Health. Further, we are working on guidelines for mission travel called the Beyond Borders Guide. And like already mentioned, we participate in events and conferences like the World One Health Congress in Cape Town, World Health Summit in Berlin, the Afrohun in Nairobi, and the ACME in Hamburg, and more. And we are currently in the process of developing approaches to assess the effectiveness of the network. So a network evaluation is in preparation. And like already mentioned, of course, the collaboration with the mentioned Lancet One Health Commission. The Commission had several pre- and post-launch events last year where Women for One Health, or the Women for One Health team, was also represented. And we also wrote a Lancet comment to the Commission that was published together with another comment and the Commission report itself. Next slide, please. So here you can see some impressions from our in-person meetings on conferences, poster presentations, and panels. Next slide, please. Yeah, so you are all very welcome to scan our QR code for our LinkedIn group and the website. On our website, you can also register as One Health expert and yeah, join our expert database. And if you have any questions regarding Women for One Health, you can always reach out to us. Next slide, please. So what can we do moving forward? Inclusion should not be added later. It needs to be part of the design from the beginning. This includes inclusive governance, active outreach, and long-term sustainability. A good example here is a study from Mutwa et al., a study from livestock health research that shows that inclusive, gender-responsive approaches can significantly improve the intervention uptake. So in the study, the authors demonstrate that restrictive gender norms limit women's access to livestock vaccines, while targeted interventions that address these barriers, such as engaging women directly, lead to improved access and also uptake. Next slide, please. So to summarize, inclusion improves effectiveness, diversity leads to better outcomes, and yes, collaboration across sectors is essential. But most importantly, equity is not optional. It is a core requirement for sustainable and also fair health systems. Next slide, please. So, oh yeah, thank you very much. That was my presentation, which I hope gave you a brief overview of the topic. And yeah, for the Q&A and discussion, I'm very pleased to also invite the co-founding director of Women for One Health, Professor Andrea Winkler, to join us. Yeah, thank you to the audience and the organizing team. And Andrea, may I give you the last word for some remarks on Women for One Health or the Lancet One Health Commission?
Yeah, thank you very much, Kim. This was a brilliant presentation, and you put it so well. I think we could say much more. Maybe just one thing to add is it is not easy to sustain networks like this. And the problem really is that it is difficult to get money only for infrastructure. We are extremely grateful to GIZ who have supported us so far, but to make it sustainable, it needs to be integrated. And I think in the long term, institutions need to take responsibility of such networks, established institutions. Of course, you could always write up research grant and put in some funds for the network that may help promote the research in question. However, it is our understanding and also experience that it's not that simple. So maybe just a call to funding bodies, mechanisms who are present, who are listening, to consider funding networks for the sake of networking and not necessarily science. I mean, science comes with it, but I think networking is a very important, extremely important and inclusive networking precondition for inclusive and equitable science. That is one thing. And maybe the second thing I would like to mention quickly, also as a lesson learned from the recent One Health Summit in Lyon, that was convened by the French president, Monsieur Macron, and the Ghanaian president, Mr. Mahama, together with other heads of states and scientists and civil society. And what has transpired from discussions there is that evidence, as through the Lancet One Health Commission, which to date I think is the most likely most comprehensive evidence synthesis is not taken up. It was mentioned here and there, but not really center stage. And I think this could potentially lead to confusion among stakeholders and decision makers. We need one sort of Bible in a way, and of course there can be other documents that are referred to, but those 10 recommendations that have been brought together over 7 years through many discussions to evidence synthesis in a truly inter and transdisciplinary way, I think they hold weight. However, institutional uptake is slow, and we would like to understand why that is. And at the same time, having a very nice audience here, would like to encourage people present and representing institutions to encourage your own institutions to have a look at the 10 recommendations and potentially, hopefully, also create mechanisms around uptake. So thank you very much to the organizing team. Again, it was a pleasure, and of course to Kim to be with you and to take part in this important webinar. Thank you very much.
Well, I would like to thank you both, Andrea and Kim, and for the very interesting presentation. I already have some questions, but first I would like to ask Anouk if there are any reflection, any comments, possibly any questions from the chat, or if somebody has the hand up.
Yes, there was a comment from the chat mentioning a report on the new European Bauhaus, which might be interesting to you if you don't know it yet. There's a chapter on urban land use and environmental justice, and it also deals with environmental health aspects, like indoor air pollution related to socioeconomic status. And it says, unfortunately, it's in German, but the link is in the chat if you would like to read it.
Okay, thank you. Thank you for this remark. Indeed, the new European Bauhaus. Actually, I would have one question regarding the very last comment. So, what is your opinion? Why is that the recommendation by the Lancet One Health Commission are not being put into practice? I mean, of course, this is again, we're talking a bottom-up initiative, so it's not coming from the policymaker, but still, I mean, it's really a top initiative, and I'm sure you have some ideas.
You asking us?
I am asking, yes, you and
Yes,
Kim,
yes.
yes.
So first of all, of course, it's early days, but it's good because it has been sort of a litmus test, really, that One Health Summit. It's early days. The report has only just been published last July. We have indeed held various dissemination events online, the main one out of Africa, and then in different regions and different institutions. So one thing is the timing aspect. The other thing, it's just, it's a snapshot that we got at the One Health Summit. And of course, it was very French focused, naturally. So I wouldn't say that the recommendations are not being taken up. I don't know. We don't know. In Germany, I know that through the One Health Task Force at the Ministry of Economic Development, Cooperation and Development, they are taken up. They are discussed. They are talked about. They are part, of mechanistic discussions. So why it was not mentioned more often at the One Health Summit, to me, this is most likely also a political question. I think it was very important that One Health Summit coined messages make it to the forefront, although they were very similar actually to the recommendations of the Lancet Commission. But other than that, I have actually, I'm a bit at a loss. But maybe someone else has has ideas how we could reinforce the uptake of the recommendations of the Lancet One Health Commission. Thank you.
Of course, this is something that we will take up in our own joint statement as well.
That would be wonderful. That would be a good idea, Ludovico.
For sure. Any additional comments from the chat, or maybe a participant would like to take the floor and add to this? Otherwise, I will go on.
There was a comment about the previous discussion that the Lancet Commission's recommendations are excellent, but the problem may be that the One Health narrative is very broad and may encompass very many domains, and how to bring that into practice, comparing to an environmental initiative, for instance.
Good point. The loss of the focus. The more people we bring on board, the more sectors we bring on board. Andrea, Kim, would you like to take this?
Kim, if you would like to have a go, please go first, and I will follow you.
No, thank you, Andrea. I think that's a good point. Me personally, I think the Lancet recommendations are quite concrete. So not sure if it's, I mean, the One Health narrative is very broad, that's true, but the recommendations are very specific. So not sure about this, Andrea.
Yeah, you're absolutely right, Kim. I mean, we are really calling out institutions. So let's say for the first three, or for the very first recommendation, just off the top of my head, it's about a global governance architecture. And we're calling out the quadripartite, and we're calling out the One Health high-level expert panel. We have been working very closely with them. It was a very nice collaboration throughout the development of the recommendations throughout the many years. But we are calling out other institutions or mechanisms or platforms to take leads on implementation on one or the other recommendation. We give potential timelines. I mean, those timelines, obviously, they are very optimistic, and we are not expecting that those will be met. But there are concrete, yes, I fully agree that despite the Lancet Commission, we feel that the One Health high-level expert panel, who has given us the current all-encompassing definition of One Health. The Lancet One Health Commission has not created a new definition. We are endorsing the OLAP definition. Despite that, I think that the concept is still fluid and broad. And that could be actually one of the reasons why stakeholders or decision makers are struggling with it. And I stop here.
Thank you very much. Not easy. So unless there are additional points, I have seen maybe a hand up.
Arjen, I don't know if you would like to take the floor. Or...
Well, I just wanted to say exactly what Andrea was mentioning, and that there are so many recommendations at the moment endorsing the aspects of inclusiveness and equity. And in this platform, of course, the question is, what can the stakeholders do? What can the research community do? What can private sectors do? And you already mentioned that, in fact, inclusiveness, equity should be part of the design of approaches of our studies. And so I was also wondering if your platform, Women for One Health, is already linked to new initiatives, or can we from our new initiatives linked to your platform and engage you in the development of new proposals and initiatives for, I think, of course, we are hopeful that policymakers and government structures will adapt the recommendations, but we should proceed with this bottom-up approach by also including the social economic aspects. And I wonder what if there's already some dynamics there, and if you are open for these engagements in these initiatives.
Yeah, thank you very much. So definitely we can, and we would be happy to connect and join forces always. We are very open for these engagements. We already connected to quite some initiatives like Women in Global Health. But yeah, happy to connect.
Well, thank you very much. This is a very nice final message to create connections. And at this point, I would once again, Kim and Andrea, thank you very much for your contribution. I encourage you to stay on board until the end of the webinar. And at this point, I would move to the last presentation of the day. We have some final remarks by the colleagues of the European Commission that will be given by Sigrid Weiland. Sigrid is the Deputy Head of Unit A1, One Health Antimicrobial Resistance at the Directorate General Sante. Sigrid, the floor is yours.
Thank you very much, Ludovico, and to all of you for the introduction and also for giving me the opportunity to present a bit what the European Commission is doing in the area of One Health, how we at the European Commission are applying the One Health approach to different areas, and in particular also to those which have been highlighted today as missing ones or underrepresented ones, which would require more attention. So this first slide is just to remind that the implementation of the One Health approach and the fight against antimicrobial resistance remains a priority for the Commission also under the present mandate. So would like to start by giving first a rough overview on the areas in which the European Commission is currently applying the One Health approach, which all require actually the application of the One Health approach to be tackled in an effective and efficient way. So I would like to start with action against antimicrobial resistance, which is actually one of the 4 front runners of the application of the One Health approach by the European Commission. So we have been applying this approach since many years now. And this because it was recognized relatively early on that there's a strong connection between the use of antimicrobials and the development of antimicrobial resistance, and that climate change, environmental pollution, and behavioral factors are actually important drivers of AMR, so that a cross-sectoral approach is urgently needed. On another area to which traditionally the One Health approach has been applied early on are the infectious diseases, the zoonotic diseases, which are actually gaining in importance already now. 60% of the infectious diseases are of the zoonotic nature, and even 75% of the emerging infectious diseases. And then the vector-borne diseases, which are also growing in importance due in particular to climate change, which is changing the dynamics of the vectors and thus of the vector-borne diseases. Then I would like now to turn to an area which until recently has been a bit underrepresented in the application of the One Health approach, namely the non-communicable diseases, but which is gaining in, awareness. And this recognizes that at least 10% of premature deaths in the EU are driven by exposure to polluted air, water, harmful chemicals, and environmental risks. And finally, the health impacts of climate change. Europe, as the fastest growing continent, is facing, as you know, unprecedented and escalating extreme climate events, which detrimental impacts on human and animal health and well-being. So this being said, we as a Commission, we recognize the need to implement the One Health approach in order to strengthen our capacity, in particular to prevent, prepare and respond to health threats. And I put the emphasis on the prevention, because this is actually where we see that the One Health approach, application of the One Health approach, could have the greatest added value. And this requires a deeper integration of also the environmental and climate change related aspects. So now talking a bit more about the environmental dimension of antimicrobial resistance, which has already been emphasized by previous speakers, and in particular Ed. So recognizing that the environment can actually serve as a reservoir for antimicrobial resistance, and also as a driver, for instance, through chemical pollution and heavy metals. Of this has been mentioned. The Council recommendation on stepping up the fight against AMR from 2023 actually encourages all member states to have in place national action plans that include environmental aspects, in particular evidence-based measures to prevent, monitor, and reduce the spread of AMR in the environment. Then also at EU level, we have revised EU legislation to strengthen environmental monitoring, detection and monitoring of antimicrobial resistance in ground and surface waters and in wastewater. Also, the new pharmaceutical legislation foresees strengthened environmental risk assessment for the authorization of antimicrobials. So what was also mentioned by previous speakers is the UNEP resolution on the environmental dimensions of AMR from last year, December 2025. And the EU actions, which I've described above, are in line with this resolution by the UNEP. Then I would also like to quickly mention, if time allows, the so-called JACRA reports by the European agencies, the EFSA, the CDC, and the EMA, so the agencies on the infectious diseases, medical authorizations, and food safety, which together, since a couple of years now, develop analysis of antimicrobial consumption and resistance. And I'm mentioning this because previously it was mentioned that there might be a link between the consumption of antimicrobials and the development of antimicrobial resistance. And this is what the JACRA reports, in particular the last one published in 24, confirmed, that there is a link between the consumption and the development of antimicrobial resistance, and also between the use in animals, including farm animals and human beings. So with this, I will skip to the next slide. What is the Commission doing in terms of environmental aspects in the other policy areas? So the Safe Arts Plan, which was published in December 2025, is the first ever EU approach tackling cardiovascular diseases through a broad, preventive and cross-sector strategy. So applying a One Health approach that links human health with environmental, societal and lifestyle determinants, acknowledging that climate change together with environmental pollution can have a strong impact on cardiovascular diseases. Then I would like to mention the serious cross-border health threat regulation of 2022, which was established also based on the lessons learned from the previous pandemic, COVID-19, which provides an overarching framework for EU-level action, and it enhances member states' prevention preparedness and enables a coordinated EU response to health threats, and covers also the threats of environmental origin, including from climate change. Then in November 2025, the Union Prevention, Preparedness and Response Plan was adopted, which describes EU-level measures that can be activated to shield and safeguard the Union against cross-border threats to health, and this by applying a One Health approach through all the phases. Finally, I would also like to mention the Climate and Health Observatory, which is an excellent example of the application of the One Health approach in the sense that it is jointly managed by DG Sante, so the DG for Health and Food Safety, and DG Klima, together with the European Environmental Agency, and in partnership with many European and international partners. And actually, the Lancet Countdown is also a partner of the European Climate Observatory. And it provides evidence and solution around the effects of climate change on health and helps policymakers at all levels to take evidence-informed decisions. And yeah, I would not like to skip also that at present, the Commission is preparing a new framework for climate resilience, which is expected to be adopted towards the end of this year, which will also include a strong health component. This is the Climate and Health Observatory, which I have already mentioned, and for the sake of time, I will not enter into details. Now, I would also like to give a few examples of how we as a Commission actually implement One Health governance, because this was an issue which was also brought up several times. So how to do it in practice, how can we further the application of the One Health approach? So we started by actually in the house by applying the One Health approach in the house. So we established a network on One Health in DG Sante, so in our Directorate General, which convenes all the relevant thematic units across the Directorate General, encompassing human, animal, and plant health, to further the exchange of information and to stimulate cooperation. And then we took it a step further by also establishing an inter-service group on One Health across the Commission, that is across the relevant policy areas, also to better provide exchange information and to promote coordinated action across the Commission. It also helps us to keep the One Health approach high on the agenda, to really draw the attention to its importance. We currently have 9 other DGs involved, but we intend to even broaden this. Then the importance of networking was emphasized by, in particular, by Andrea Winkler. So I would like to give also the example of the AMR One Health network, This is a network together with experts from member states, stakeholders, and representatives of different EU institutions, which convenes regularly 2 times per year to enhance the coordination and exchange of best practices between representatives for human health, veterinary health, and the environmental sectors. Another excellent example of how One Health can actually work and practice is the collaboration across the EU agencies, the so-called cross-agency One Health Task Force, which was established in 2023 by 5 EU decentralized agencies, the ECDC, which is responsible for infectious diseases, the ECHA, which is responsible for chemical substances, the European Environmental Agency, EFSA for food safety, and EMA for medical authorizations. So this task force is also furthering collaboration between the different agencies and facilitating also the provision of coordinated scientific advice between the different agencies for the policymakers, so in particular the European Commission. And it has also served as an example for the interagency working group on AMR, which was established upon the request by the Commission amongst the same agencies, and also to facilitate the cooperation to answer future requests by the Commission. So all of this action to need to be implemented, also the training of the interdisciplinary workforce needed for One Health. And at EU level, we are actually providing EU health preparedness training program under the Serious Cross-Border Health Threat Regulation. Under this regulation, we have already provided, for instance, 80 workshops, including on One Health. And what is also important is One Health simulation exercise, which we have held in 2024. Sorry, if my memory doesn't play me tricks. So I see it was in 2024. Of which the purpose was to test the coordination and operational interfaces between the animal and human health sectors and representatives who participated in this exercise in a realistic simulated situation, in this case on avian influenza. And interestingly, this exercise found, not surprisingly though, that indeed the cooperation between the different sectors in crisis situations needs to be reinforced and to be smoother. And another recommendation from the findings was actually to consider also more the environmental sector, to involve them more closely in such situations. So what are we still missing? Training alone is not sufficient. So we really need to step up and institutionalize interdisciplinary cooperation. So the cooperation across sectors, also at national level. In support of this, the Commission is also doing so-called One Health fact-finding visits, where our colleagues really go to the member states and have a look at the cooperation between the different sectors, and afterwards provide recommendations on how to do this. For instance, that's the example again of avian influenza or of vector-borne diseases. I also recently learned that there are already some nice examples of how to really include One Health in the curricula at universities. So, for instance, at the university of one Finnish university, there is already a doctoral degree in One Health and a bachelor program on human and planetary health. Finally, also to reply to a need which was emphasized by Kim, I think it was a need for more transdisciplinary research and innovation in a One Health approach. Let me quickly mention that the life science strategy by the Commission was published in July last year. And one of the actions under this life science strategy is actually to facilitate and to promote research and innovation in a transdisciplinary way. So we would also like to confirm the need for an inclusive, fair, and equitable One Health. Actually, this approach is at the heart of the One Health approach, which was also emphasized by the SAM opinion on One Health governance in the EU, which has already been referred to several times. And also the recent own initiative opinion by the EESC, the European Economic and Social Committee, emphasizes this. It acknowledges the need to support the role of women within the One Health approach. And it also says that the gender equality dimension is an integral part of EU policy, should be an integral part of EU policies, health policies. So in the EU, we are already applying this principle in a number of policies. I would like to mention in particular the Safeguards Plan, which I already mentioned before. And this will, amongst others, address the inequalities in cardiovascular care in a coordinated approach, with a special focus on women, as they are more likely to be underdiagnosed, undertreated, or underrepresented in clinical trials, leading to delayed diagnosis and treatment. Further areas and policies where we pay attention to gender inequality are also initiatives in the areas of mental health, cancer, medical research, diagnostics, and treatments. So now, looking ahead, I would like to draw your attention to upcoming events. So first, the European One Health the annual scientific meeting of the European One Health Association, which is actually organized by the people who are participating or organized this webinar and who are responsible for the Peitho. Then there's the upcoming World One Health Congress in Lisbon at the beginning of September, where we as Commission will also be present. And then, importantly, the FAO Global Conference for Actions on One Health in Agri-Food Systems in Rome in September this year. Now, it has also been mentioned that we now have a number of sets of recommendations, and the question is now actually how to implement them, but also how to bring them together and how to consolidate them. And I think from our perspective would be worthwhile to look into this. So they are all publicly available. We have the recommendations from the One Health Conference in Copenhagen, the recommendations and high-level deliverables from the One Health Summit in Lyon, which just took place. Because we have the recommendations from the Lancet One Health Commission, and not to forget the recommendations of the scientific advice mechanism, which at present acts as a sort of compass for our work at the European Commission. So I would think it would be worthwhile really to reflect a bit on how we reconcile all of this, how we bring this together, and then to think about how to implement it. And with this, I would like to thank you for your attention.
Thank you very much for your presentation. I hope that this could be made available on the platform. Because well, great, thank you very much, because then you can really we could really go back to it and check the tools that the Commission is offering, the pieces of legislation that we have to align with what is going on, the needs of the Commission, so that we can really better set up One Health initiatives. And from my point of view, I was also happy to see that non-communicable diseases are mentioned. That really show us how vast the One Health arena is. Of course, we look at specifically at infectious diseases at AMR, but there is much more. New challenge, also a new challenge to keep the focus. Well, you also mentioned a simulation exercise on avian influenza. Just to inform the audience here that at our next webinar in 1 month, we will discuss about the simulation exercise, a national simulation exercise on avian influenza. We are a little out of time, but maybe if there is just one quick comment or one quick question, we could take it. Just one, just very, very quick. Anouk, do we have anything on the chat? Something that we could very briefly address?
No, there's no one on chat.
Yeah. Okay. We need some time to digest all the information. Again, I would like to thank you once again Sigrid for her presentation. Thank you very much. And this will be available on the platform. I would encourage all the people that are not in the platform to go and join, that we can really work together, we can exchange together. And as we are a little out of time, I would just like to reflect very, very briefly about what was going on in the last hour or so. So our aim was really to analyze the underrepresented sector in One Health, and the quintessential underrepresented sector is still the environmental sector. Although I would use the definition by the One Health high-level expert panel and talk about the wider environmental sector, including the ecosystems. From the presentation of Edward, we see that things are moving in the right direction. I think, well, there is still a lot to do, but things are moving in the right direction. If there is one take-home message, it would be that the lesson learned from the AMR can really be, I would say, used and applied to other scenarios where we are still struggling a little bit. We then move to the presentation of Kim, highlighting the importance of bringing on board the social sciences. Well, from her introduction, we have seen how important is the social aspect, possibly even the economic aspect, which is all fine. We can consider the social, we can consider the economic, we can consider political aspect, but much is lost if we do not consider equity and inclusion in One Health activities. And I really would like to echo the concept that really equity and inclusion should be at the core of every One Health activity. And with this, I think we are well over time. I would like to thank the speakers once more for their interesting presentation, for the discussion. I would like to thank the audience. I would like to thank the Health Policy Platform for their support, and see you in 1 month. Have a good day. Thanks.